Okay, this is the plane radiograph of the right wrist, and it's the frontal view as well as the lateral view in a patient. So first looking at the frontal view, it shows a triangular shape of the lunate bone. I'm looking at this scapholunate distance, which is normal. There's no scaphoid fracture that's seen. The rest of the cortices appear normal. And there is no significant joint space narrowing or erosion seen on the frontal view. Yeah, so moving on to the lateral view. Now, considering that I've seen a triangular appearance of the lunate, okay, there is also some increased sclerosis involving the lunate bone. So the two differentials that I'm thinking of is either Kienbock's disease involving the lunate, but I will also review the lateral to ensure there is no dislocation, lunate or perilunate dislocation, because the lunate appears slightly triangular in shape. I'm assessing the alignment of the distal radius, the lunate and the capitate, which appears normal. There's no dislocation. So finally, the final diagnosis would be that of osteonadionecrosis involving the lunate, which is a Kienbock's disease. And I would convey this to the referring physician and also ask him if there are any etiologies which could explain this, whether the patient is on steroids or whether the patient has had any previous fracture, and review any previous radiographs for the same.
Are there any associations of Kienbock's that you can see on the plain film?
I was looking at the scaphoid. Can I just, can I zoom in and just look at the scaphoid contours?
You can. The scaphoid is normal though. What about the ulna?
So there is a negative ulnar variance which can predispose to this, which is seen on the frontal view.
Okay, that's fine. And this was just our starter case, which isn't anything too complicated, but yes, Kienbock's, so sclerosis, loss of height of the lunate. You did talk about the alignment of carpal bones and so on, but yeah, it's fairly straightforward. And then, because there's not a huge amount to say, it's important to say there's negative ulnar variance, which is associated. If you have positive ulnar variance, you're more likely to get something called abutment. So you can get abutment between the lunate and your ulnar, and you can get some sort of changes. But yes, negative ulnar variance is associated with Kienbock's, and they just need an orthopedic review. So, but overall, I think you did well. Any questions?
No, that's fine.
You seem to be ready. So good luck with the.
Yeah. Anyway, thank you so much. I think all your cases were very nice, and there's a lot of learning from everything.
Oh, thank you. I feel bad. We kind of ran out of time, I think, on a few of them. There would be a lot more to say about some of them, but never mind. So yes, well done, everyone.